Good evening, everyone. How are you? Hope you're doing good. Today, I'm going to talk about one of the important topics, that is new obesity guidelines. Focus on health conditions, not just BMI. Let's go into the topic. So, a group of leading endocrinologists, diabetologists, cardiologists, gynecologists, and bariatric surgeons, they have published new obesity guidelines in the Journal of Association of Physicians of India, JAPI. These guidelines represent a significant departure from the traditional focus on BMI alone, instead stressing the associated functional, psychological, and metabolic conditions associated with obesity. The authors have highlighted risks of abnormal obesity even at lower BMIs. The guidelines also propose updated bariatric surgery eligibility criteria. At the international level, these new guidelines have already been implemented. Said Dr. Shashank Shah, internationally acclaimed bariatric surgeon and co-author of this paper, India, known as the diabetes capital of the world, can no longer afford to lag behind. What is the new obesity guidelines in India? According to the guidelines in India, a person is considered overweight when their BMI is between 23 to 25 kg per meter square, while a person with BMI over 25 kg per meter square is considered obese. Stating that obesity may cause serious complications, co-author of this paper, Professor Dr. Neeta Rohit Deshpande, endocrinologist and obesity physician, defines the adverse effect of obesity on 4 areas: metabolic, mechanical, mental, and monetary. The metabolic aspects are in the form of worsening of the conditions like diabetes, BP, heart trouble, etc. The mechanical aspects include effects in the form of pain of ankles, knees, bones, and sleep apnea, etc. The third M, the mental impact, is in the form of aggravated anxiety, sleeplessness, etc. And the fourth impact is on the patient's pocket, the monetary impact. The Professor Dr. Neeta says there needs to be a change in perception of both medical practitioners as well as the patients regarding the obesity. People should first start recognizing obesity as a serious disease that demands treatment, and its seriousness should not be viewed simply from the conventional yardstick of BMI alone. So according to the recent nationwide study, obesity affects a staggering 40.3% of adults in India, disproportionately impacting women, urban populations, and individuals over 40 years of age. The authors highlight the unique concern of abdominal obesity, where excess fat accumulates around the internal organs, increasing the risk of diabetes even at the lower BMIs. The paper presents a compelling case for the revised approach. Dr. Shah describes a 45-year-old woman with a moderate BMI, but severe diabetes, neuropathy, sleep apnea, and joint pain. Her quality of life and mental well-being were significantly affected. So under the current classification, she would not qualify for aggressive treatment, explains Dr. Shah. But her functional and psychological disabilities demanded. This patient ultimately underwent bariatric surgery with remarkable success, showcasing the potential benefits of a broader assessment of obesity. So what is the updated bariatric surgery criteria? Recognizing the limitations of the BMI, the guidelines propose updated criteria for bariatric surgery eligibility. These are BMI over 35 kg per meter square, with or without comorbidities. Lower BMI thresholds with increasing number of comorbidities. Uncontrolled type 2 diabetes despite treatment, excess abdominal fat accumulation, waist circumference with comorbidities. So the authors urge all the medical professionals and associations to adopt these new guidelines for immediate implementation. By shifting the focus beyond BMI, India can improve diagnosis, treatment, and ultimately improve the lives of millions struggling with obesity and its associated health burdens. Thank you so much for your kind attention, and kindly share it to your friends.